It's a noisy world, from busy streets and offices to loud music and movies. In this week's Ask an Expert discussion, I'm joined once again by Jean Roveda, owner and audiologist with Sudbury Audiology Clinic. Jean, thank you for joining us once again via Zoom.
Thank you for having me once again.
So talk to us about noise-induced hearing loss. What is that?
Um, Noise-induced hearing loss is nerve damage that typically begins in the higher pitches, usually around 3 to 4,000 hertz. And it develops gradually from excessive noise exposure. It affects both ears equally, but like firearms, sirens, explosions can produce hearing loss in one ear as well. So typically noise-induced hearing loss, we would say it's a bilateral hearing loss, but it can happen that it can cause a unilateral hearing loss. Noise-induced hearing loss is actually the second most common hearing loss after age-related hearing loss. And believe it or not, Marina, it's actually 100% preventable.
We are exposed to a lot of these loud noises every day, so how can people prevent it?
Um, I mean, I think it's important to recognize the common risks first. Um, Typically, once again, it affects the higher frequencies, and the clarity in speech is affected. Therefore, it could cause some communication barrier in different listening environments. People typically notice it in a noisy environment. Another common risk would be, developing constant tinnitus or tinnitus, which is generally defined as ringing in the ears. To answer your question, preventing would be a good idea to really educate, the employers about noise exposure. And if you are subjected or if you work in a noisy environment, I definitely recommend that you use hearing protection, and potentially for the employers, maybe an annual screening of the employees that are subjected to those types of environments.
And just another question, talking about, preventing that. We see a lot of young children or babies who wear those ear muffs or earphones. Is that important to do at a young age?
Definitely. I mean, there's actually even some studies, believe it or not, that show that when you have a baby in the womb, or a lady that's pregnant, if she goes to a party, they've done some studies after that, and they've noticed that there is some type, or there could be some type of hearing loss. So I definitely would encourage the babies to wear hearing protection if they're subjected to a noisy environment, 100%.
So how do you know if your hearing has already been damaged by noise?
Um, Great question. I mean, if obviously, if you've worked in a noisy environment and you're suffering from hearing issues like asking people to repeat, issues on the phone, issues hearing TV, or it could even be as simple as, not hearing the signal light in your car. Another sign that you've damaged or might be damaging your hearing is actually ringing in the ear, or any other sounds that you perceive that are not, in the environment. The tinnitus, or ringing in the ears, or tinnitus, can be described in over 200 different ways.
So if someone feels they're already suffering from damage, what are the next steps?
Next step, I guess, what I would recommend would probably be a, simple hearing test, and this can be done through your primary healthcare provider, so your nurse practitioner, nurse, or family doctor, or you can call directly an audiology clinic, and then I'm sure they can definitely help you out and set you in the right direction.
Really important information. Thank you once again for this, Jean.
Thank you.
Jean Roveda is the owner and audiologist with Sudbury Audiology Clinic. And for more information about our Ask an Expert segment or to view episodes, go to our website, ctvnewsnorthernontario.ca, and click the tab Ask an Expert.